So what you can see here, here's your scoli over here, right, Heath?
Mm-hmm.
And so you've been crooked, like you were diagnosed, what, as a teenager, right, with your
Yeah,
scoli?
13. So it was, what is that?
How many?
19,
Nin-
1985.
1985. So over the, you know, how many years since then has it been? Since you had your scoli?
What's 85 and now it's 2019?
Yeah, so that's, what, 30 years? Something like that, right?
Over 30.
Yeah, so over the last 30 years, right, you've had this right thoracic curve, right, which is 44 degrees, but this curve had to compensate, right?
Yeah.
And so this disc on this side here, right, at L45, this is your left side,
Yeah.
has been tilted. So the loads on this side were what? Higher or less than this side? They're higher, right, because you're squeezing down.
Yeah.
Does that make sense?
Yeah.
So what happened was over the last few years, that's why you got this disc herniation. You see that? So the disc actually tore, and some of that disc material kind of snuck out. And it's actually just hitting on that nerve a little bit. And that's why you have the pain going into that butt and going down towards that knee area, okay?
Right.
So the scoli actually kind of puts you at risk for that. But there's a lot of things we can do conservatively to help with that, to, treat it conservatively. And sometimes we'll even, if let's say this disc herniation got worse and you had persistent sciatica, sometimes we can just do a microsurgery here and just deal with the disc itself, and then continue to use like the Schroth therapy and possibly even adult bracing to help you with the scoli. So there are still conservative things that we have to do, but you can see how the scoli kind of puts you at risk
Yeah.
for developing that lumbar problem.